Assalamualaikum and very good day to all audience. My name is Muhammad Lukman bin Muhammad Lazim. I am a physiotherapy student from UITM. Today, I would like to present two articles that I have reviewed related to cerebral palsy. In this presentation, I will mention cerebral palsy as a CP. This assignment is conduct for pediatric PhD 573. The objective for this assignment is to address principle of human development, the concept of motor control and motor learning in pediatrics, to address principle of international classification of functioning disability and health ICF in pediatric rehab, to critically evaluate the evidence of the motor intervention that integrates learning principle for CP using the home-based program and social assistive robot. The first journal that I review is from Disability and Rehabilitation Assistive Technology. The title of the article is A Motor Learning Therapeutic Intervention for a Child with CP through a Social Assistive Robot. This article is written by Jamie, Anna and Eduardo 2019. In this article, the researcher used Social Assistive Robot, which is SAR, as an intervention to therapeutic for CP child. The second journal that I have reviewed is from BMC Pediatric. The title of the article is Home-Based Bimanual Training Based on Motor Learning Principles in Children with Unilateral CP and Their Parents, Rationale and Protocol. Generally, the second article is study protocol that use home-based training as intervention for unilateral CP child. For the information, social assistive robot known as SAR is well acceptation as assistance in a rehabilitation program which is proved to be more motivate patient in therapy session. SAR also was upgraded to be more live, which is capable to move autonomously, able to communicate and interact used in social or commitment. SAR also been designed as a trainer, motivator, and facilitate communication as assistance in rehabilitation program for a better result. SAR such as humanoid robot as a tool for achieving educational goal which is able to generate level of attention and develop social interaction of a child. Next, we go to the method. Type of the study for this paper is single case study. The population has been selected from 8 years old boy with dyskinetic CP, which has been assessed by using based on gross motor function classification system GMFCS and manual abilities classification system MACS with level 1 to 3 and assessed by communication function classification system CFCS. The intervention. The 16-session physical therapy program has been running with 2 sessions per week with a duration of 45 minutes. For the first session, subject was done conventional therapy, focused on motor control skill. Then continue the second session for motor learning program, which used a robot as a social assistant. The cycle was continuously repeated alternately for 16 sessions. The outcome measure. This outcome was being measured by using GAS, which stands for Goal Attainment Scaling, due to the result was evaluated in objective, which allows setting individuals' objective and also sensitive to the minimum changes of the step. At the end of the session of this study, there was an improvement in step of a child without falling, with a GAS +2 at session 5 plus 1 on session 11 and plus 2 and at session 16. The author had concluded that social assistive robots such as humanoid robots give a positive impact on the therapeutic process of the child with motor disabilities and achieve the objective of process in the therapeutic session among CP child. This study has been discussed on important topics which apply the assistive robot in process of therapeutic session for improving the motor learning process. This approach shows benefits to the subject, which can encourage the child to be working more than targeted and finish the task. On the other hand, this program was able to improve the mood of the child and motivating the child to work by the excitement of humanoid robots. The main objective of this study was to validate the effectiveness of the physical therapy program, improving the participation of children to fulfill the task targets using this device. However, the study has been done was single case study in which the sampling size is small to determine the validity of effectiveness and rationale of the study to be applied in rehab program. According to Jennifer 2017, the appropriate sample size is critical for reliable and valid result. The small size of sampling will hazardous the unexpected significant finding leads to the bias of a result. Finally, the implications of this study are: first, able to encourage in motor learning process as the child able to improve in steps and able to finish the task without fall. Second, improving in mood of child during rehab program that may get excitement of the child to complete the task. The second journal that had reviews was Study Protocol from Biomed Center BMC Journal of Pediatric. The title of this article is Home-Based Bimanual Training Based on Motor Learning Principles in Children with Unilateral CP and Their Parents, Rationale and Protocols. In this article, the principle of protocol study has been introducing to the unilateral CP child for motor learning skill, which focus on neuroplasticity as a measure of rehab program based on the previous journal and study. Usually, in the center-based program, the concepts that been used are goal-directed training, constraint-induced movement therapy, and hand-arm bimanual intensive training. However, the previous study which used home-based training intervention mentioned the effectiveness of the training based on two reasons. First, this training is a high training intensity combined with task-specific bimanual training of upper limb of child, which this will motivating child and encourage in child capabilities. Second reason related to the continuation of training in the child daily life over the home situation. This will help in reducing parent stress due to limitation of therapy and promote compliance in children. Therefore, this study aims to improve the bimanual skill of children and minimize therapy-related parental stress. At the moment, this study protocol needs to be looking forward in order to apply in the rehabilitation program because the protocol was designed to apply for children in the future and current situation according to the natural rehabilitative with natural environment focusing mainly in daily tasks, and yet no evidence-based practice exists to make home-based feasible in life situation. Meantime, prolonged period of the implicit intervention may give a positive impact, such as child able to create the creativity in order to solve naturally by guidance of parents. This can be understood by the intervention of the implicit when parents need to encourage them to perform the task by looking at the progression of the movement either cross or fine motor movement without exact instruction to the child. This can be leads child to be more focused and more less pressure on the child in activity. In addition, parents able to less their burdens into prompting of the child. However, the program of intervention plan was a too long and complicated plan which can predict a reduction of their adherence among parents and may develop stress to the parents. The time needs to spend more in training because the protocol only allowed for parents to instruct rather than prompt the child on activity. So, the remedial educationalist role as the support team to both child and parents. The analysis should be ruled out for the psychologist impact of the parents during the training session so that can be evaluated and undertake the issue. This will help the researcher recognize the main issue that parents are facing and resolve the problem. Therefore, the remedial educationalist is a very important body for proceeding with the study protocol. Additionally, the pilot study can be running out to evaluate the psychological impact of parents for reducing the stress situation among parents during rehab program. Therefore, with home-based training, the child will learn new skills for gross motor and fine motor through the natural environment indirectly. Parents will also undergo the therapy on their child can help reduce healthcare costs and additional costs that can result a burden for some parents. Home-based training also is able to build family care relationship and build partnership between parents and professionals. Comparison of both study, SAR or social assistive robots primarily introduce rehab program to children who can follow instruction, are in good cognitive state, and selected for children with dyskinetic problem, especially center-based training that monitors therapy directly that focus on gross motor function, for example walking, and indirectly manipulating interaction to the environment and understanding contextual situations. Meanwhile, home-based bimanual rehab programs are conducted based on patients as early as 2 to 7 years of age who have unilateral CP. This training requires the cooperation of a multidisciplinary team and parents in training CP children who focus on task-oriented activities where they train children's gross motor function and motor skill naturally based on functional ability in the environment. As a conclusion, both training helps in development of CP child based on their aims and goals. However, I prefer to use home-based bimanual training in clinical setting due to its practical, affordable, and feasible to practice by parents. In addition, the child also capable to adapt with natural environment, so indirectly will help engage to the therapy.